I've been living here in the valley close to 9 years, and I'm going on with diabetes since I was 38. Right now, like I tell you, my eyes, I don't feel anything. But I was recently diagnosed with diabetic retinopathy, where I can lose my eyesight, and like I don't want that. I don't want to lose my eyesight.
The food in this culture is very rich, very fattening. The tortillas, the rice, the beans, all these sauces that we like to put on our foods. But it's part of what causes some of our medical problems. I think Morris is hungry. I know.
We have one of the highest number of fast food restaurants in the country. And it's a lot cheaper to buy carbs, right? You eat more calories, increase weight, and you have the reason why about 45% of the population here have diabetes.
There are communities that are often left behind, and I'm from one of those communities, so I'm particularly passionate about services and technology solutions that help reduce the inequities that exist in our healthcare system.
This area in South Texas is medically underserved. About 85% of the community are Hispanic, and the prevalence of diabetes is higher on the indigenous American, African American, and Hispanic population. So there is not enough doctors, enough providers to give a good attention to the medical problems that this population have. So we are using the very new metric retinal service to get a very quick retina reading.
What we knew is that often if you referred people away from a primary care doctor, they would not come back. So we had to make this an easy, portable solution that could be used in a doctor's office, so that if I come in once for my diabetes check, I could also have my retinal services examination done. And it had to be able to be used by people with not high skills from an operator perspective, because we knew we could not put an extra burden on the primary care practices.
You can come out. You see little dots in your eye? Yes. Okay, that means we got a good picture. Just waiting.
This simple intervention is so impactful because without the 3 to 4 months waiting time, we are detecting a lot of cases that otherwise we will not. So it's a powerful impact in the community for early detection and to avoid the blindness in the long term.
Working with my dad has been great to see the impact that we've made in our patients' lives. And access to new technology has been extremely important in our ability to provide patient care. That's where the Verily Retinal Service comes in. We've been able to provide patients that haven't been able to understand clearly the condition of their eyesight and the risk involved with the progression of their diabetes.
Now, when you screen hundreds and even thousands of patients, in 24 hours we get a report with details whether or not there is any degree of retinopathy. And you pick up so many diseases that patients didn't know that was there.
You can have a seat right here.
It was a great thing today to speak with Dr. Pena specifically about his patients and his population.
Yeah. All right, that means we've got a pretty good picture.
All right.
To have him say that 4,000 of the 8,000 patients he cares for have diabetes, and that his practice is making real strides in the lives of those patients. And we know that people who would be blind without the services that we're rendering really makes my heart happy.
In the hospital, they have about 800 deliveries a month.
800 a month. One of the things I'm most proud about at Verily is that we bring our technical expertise together with our clinical expertise. We think about data as a key element in designing and driving people to a better state of health. And as data science improves, we're more able to develop solutions that are specific for that individual.
Now with this machine, he's actually showing you what I'm going through, and if you don't take care of yourself, eventually you're going to lose the sight. It's an eye-opener where you'll realize, okay, something's going on in my body. I got to do something.